Alright, so that piece of foam I gave you, the long one, you can fold up a hand towel and raise it to about 3-inch height. And you do this once a week. Same thing with the ribs, once or twice a week. The foam you place under the right thigh. So it's just below the crease of your buttock. And you just lay for 2 minutes, and this gaps the hip joint. It engages the receptors that are in ligament, capsule, and tendon, and it relaxes them, and it keeps your hip extension normal. We treated that day 1. When I saw you yesterday, it was still normal, but we want to do this at least once a week for 2 minutes to make sure that we maintain that mobility. Okay? And the foam is used to treat the low back. So you take the foam and you place it against the middle of your pelvis. So this is the bottom of my belt line, and this is my tailbone, and so the middle of it is between those 2 points. Lean against the wall, leaning into that foam. Your feet are as wide as your shoulders, and your feet are 4 inches forward. Can you see my feet? And then you're simply going to bend back and forth 30 times. You're going to touch the wall with your shoulder blades. Then you're going to bend forward slightly, nose over toes. And just repeat that 30 times. And again, don't think about it, just do it. A lot of people ask questions, but if you follow those instructions, the setup will be perfect, and the execution will be perfect as well. But I'll answer any questions. Okay? And then, for the right foot, we want to maintain that pronation of the rear foot and midfoot that we achieved. And so you stand, and your left foot points outward, to the left. Imagine an axis, a steel rod going through your shoulder, your hip, your knee, your ankle on the right side of your body, and you're twisting your upper body. Can you catch that? You're twisting your upper body all the way to the left, and then you do little tiny rotations to the left, and 30 to 100. And I want you to do this daily for a week, and then do it at least once a week thereafter. Build up to 100 reps. Okay? And you should feel your foot splay out. You should feel that arch flatten. Okay? The torsion exercise with the foam against the wall, that's a great one to do every day. It takes 2 minutes. I had you on day 1 lie on your back. And hug the right knee outside of your shoulder. Now you can put the other leg straight or you can bend it, doesn't matter. Do whatever's comfortable. And you do this for 2 minutes. And I want you to do it once or twice a day for a week. And then do it twice a week thereafter. Okay? And then we had you sitting to work on the lowest spinal joint, the L5-S1 junction. And so you're sitting and you bend forward slightly so that you can rest on your hands. And then you're going to bend to the left side. And you just stay in that side bent position for 2 minutes and keep contact with your sit bone. Don't let it come off the seated surface, okay? So you just lean over to the left side like this for 2 minutes. And you twist your shoulder forward on the right. Okay? So you're not only bent forward and sitting, but you're side bent left and you're rotated left. And so after you give it a 2-minute stretch, then you do 30 reps of gentle oscillations. And I want you to do this one every day for a week. You can do it twice a day, and then do it twice a week thereafter. And I mentioned a body worker named Jay Kratz, K-R-A-T-Z, and his clinic is called Meta Movement, but he abbreviates it MTA-MVMT, J-K-R-A-T-Z. I think it would be worthwhile to see him. And I would like to see you one more time. Could be a week from yesterday. Just let me know what's good and give me a progress report in about 3 days. And I think this covers everything. If you have any questions, please let me know. I hope this is helpful. Thanks a lot.